My name is Lucy Hodder. I'm the Director of Health Law and Policy Programs at UNH, and on behalf of UNH School of Law, the College of Health and Human Services, and the Institute for Health Policy and Practice, we welcome you here today. Thank you so much. It's amazing to see a room full of people who want to talk about Medicaid, and that is what we are going to do. We are going to have a community discussion about Medicaid today and what's happening in Medicaid, about Medicaid payment reform and where we might be going, and about Medicaid tomorrow and what's happening in D.C. if we can make any sense of it. And it's just tremendous to be having you all here discussing this at such an incredible time in our state and our federal policy arenas. And I feel like I have to say another incredible time because it seems to keep happening and happening. So we are incredibly lucky today to have our sponsors who have supported this event. The Endowment for Health has been instrumental and a lead sponsor. Thank you, Yvonne, and the Endowment. WellSense Health Plan and the Boston Medical Center Health Plans, Susan Coakley is here, have also been lead sponsors, as well as New Hampshire Healthy Families supporting this event. So we really appreciate that support, with additional support provided by Minuteman and Harvard Pilgrim Health. So thank you to them. We have some important housekeeping. I just want to briefly talk about some housekeeping details. This session is recorded. It's also being videoed, so remember when you ask questions that that's the case. We have a Twitter feed, which is hashtag NH Medicaid Future. It's right there. So feel free to tweet, follow the Twitter, participate that way in this dialogue. We also have Wi-Fi, but if you all could do that conservatively so it's not too distracting, that would be great, and turn off your cell phones. The Wi-Fi is the UNH Public. We do have food for you all. I see you all have coffee, and feel free to replenish yourselves, and there will be lunch before our amazing lunch speaker. The folders you have, there was a lot of care and effort that went into the folders. We have in there for you not only the presentations of those who are doing PowerPoint presentations, we also have a Medicaid fact sheets. When we go into payment reform, we have experts from Massachusetts, Maine, and Vermont coming. So we have fact sheets for New Hampshire, Maine, Vermont, Rhode Island, and Mass. And we also have some other information about the Institute and Health Law and Policy Programs at the law school in there for you. So please take advantage. We have a program for the day that has all the bios of our speakers, who we are incredibly lucky to have with us today, particularly Diane Hasselman, who will be speaking at lunch, here from the National Association of State Medicaid Directors, and Cindy Mann, who is with us from Manat, formerly at CMS. We also have Deb Fournier from the department, and many others here today, so thank you. Without further ado, I want to welcome a number of folks who are going to say hello to us, who've been instrumental in what we do here in any number of different ways. And the first is a senator who we all know, who is both the majority leader in the New Hampshire Senate and the chair of Health and Human Services. He served in the state Senate for many years, and previously in the House as well as U.S. Congress for us. He has been integrally involved in New Hampshire Medicaid, and never, never, never shies away from a challenge in our healthcare delivery system or elsewhere in our state. And part of that may be because he's climbed the grid 5 times, so there is no challenge that is too difficult for him. Senator Bradley, thank you for coming today, and please come up and say a few words.
Good morning, everybody. Thank you very much, Lucy. I haven't climbed the grid 5 times. I've climbed it 1.5 times. But that's still about 1,000, 4,000 footers in New Hampshire. I'm close to that milestone. And Lucy's a climber, too, and, you know, you should give her note of it. I haven't seen you in the mountains yet, but our paths will intersect at some point in time, maybe on the summit of my favorite peak, Garfield. So there are a lot of people here that I think we all know each other pretty well from the debates in the legislature about Medicaid expansion. I think the program is working as intended. 50,000 people have access to health insurance that they didn't have before, other than the emergency room, the most expensive care. Preventative services are up. The individual anecdotes that we all hear from people have been very positive. The department, it's good to see Commissioner Toompas here, who helped us originally, and now Commissioner Myers has done a good job. Where I saw Deb, where are you? There you are, right in the front row. No wonder why I can't see you. You know, the department has done a really good job, I think, of working with all of you as advocates to create a program that's functioning well, and I think it's a credit to all of you for your hard work. The New Hampshire business community has been behind this program because they see a reduction in uncompensated care as something that helps keep a lid on rising health insurance costs. So we've been able to build a coalition that is the kind of thing that should be done in Concord, kind of thing that should be done in Washington, that's bipartisan, that works, that protects taxpayers at the same time as it solves problems. And that's always the balance that I try to find in the State House. It's going to be a busy day today, as you know, and I'm going to have to exit stage right in just a minute because my good friend and I, Lou D'Alessandro, are on the exchange today. And before I give my one message that I want you all to take away, I'm going to give a shout out to Steve Shurtleff and Cindy Rosenwald, who were instrumental in creating the bipartisan consensus around both pieces of legislation that happened. Senator Odell, Senator Larson, Senator D'Alessandro, and oh man, I must be getting old. My friend from Hollis, Peg Gilmore, and Senator Morse. We really, a lot of us pulled this together on a bipartisan basis, and two of them are sitting there, and I think they deserve a round of applause. So let me just say this before I go to the next thing I have to do. A lot of changes are coming in Washington. We can't control those changes. We can advocate for things through our delegation, and that's certainly appropriate. But things may be somewhat out of our control as to what happens in Washington. What's not out of our control is how we respond to it. There will be challenges. There's no question about that. There may be less money. There may be more flexibility. How we make that work is the big question, to protect the 50,000 people that have had health insurance. It's my goal to be able to do that. I know it's going to be your goal to be able to do it. And the cooperation that we had in the legislature with all of you as advocates, with the department, is going to be sorely tested. And it will be incumbent upon all of us to continue to have the bridges that we need to take whatever new reality comes out of Washington and make it work for New Hampshire. That's my message. It's about relationships. It's about working together. It's about a common goal. It's about trying to put some of the partisan pressures that we all have. They come with life in the public arena, don't they, Steve? They certainly do. But if we work together, I think we'll be able to make the best out of whatever is sent our way from Washington. That's my message, and enjoy the rest of the day. Lucy, hope to see you out on the hills pretty soon. Thank you very much.
Good morning. My name is Mike Farrar. I serve Dean of College of Health and Human Services at UNH. And to keep with our climbing theme for a bit, this year my son got married. He's 29 years old. And he said, "Dad, I'd like you to be my best man." And I was really honored and taken back by that. It was really neat. But he also said, Dad, I don't want you to come to the bachelor party. And I said, okay, Nick, I don't want to come to the bachelor party either. It's not a place for me to be. But what he did say is, I'd like for us to do a trip together. And so we looked at a variety of different things, and we actually climbed to Everest Base Camp in 2009, and we decided we were going to go to Iceland. And we climbed some of the glaciers around Iceland. We did had a great trip together. And so he called me up 2 weeks ago, and he said, Dad, I'd like to go to Mount Rainier. And I said, Nick, that's some pretty big stuff. And so that's climbed around 14,000 feet on basically a sheet of ice going up there. So I was talking with Lucy last night because I'm going to need some help in training and using all of our 4,000 footers that we have in New Hampshire. In fact, when I moved here a couple of years ago, I climbed Mount Pierce as my first mountain. And I chose to do Pierce first because he's the only president from the state of New Hampshire, and I should have done his mountain first. And so I did Pierce first. So I'd like to thank Lucy and Joe Porter today, because today would not have been possible without them. Their vision and leadership in putting today's conference has been outstanding. And I also like to thank their team, Ashley Peters, Bridget Drake, Allison Rattal, Susan Shumway, and our students, Megan Shield and Meredith Venstra. They have done an outstanding job in putting together a tremendous program today. So please join me in thanking them. I'd also like to recognize our honored guest, Senator Bradley, who was just here, and Senator Hassan, who will be here later today, as well as some of our key speakers, Deb Fournier, Diane Hasselman, Cindy Mann, and everyone else who's participating today, as well as all the sponsors. Thank you to all of you in sharing your knowledge and your expertise with us today. Just to share a bit of information about the Institute of Health Policy and Practice, it was created over 15 years ago under the direction of Ned Helms, and now it's being led by Joe Porter to address the issues facing healthcare in New Hampshire. IHPP's mission is to conduct and disseminate high-quality, cutting-edge applied research and policy work that enables health system partners to implement evidence-based strategies to improve population health. I'd like to share with you a couple of their major projects this year. The Institute has been working with the Department of Health and Human Services with a large focus on Medicaid policy issues since the inception of the Institute 15 years ago. They are playing a leadership role with New Hampshire Purchasers Group to improve the quality and efficiency of effective health care and sharing best practices. The Center for Aging and Community Living focuses on key issues related to aging issues, including long-term care needs that are critical for Medicaid. And the Center for Health Analytics reporting tools that are developed to create analytic reports to provide system performance measures of quality, utilization, and cost across systems and regions. The New Hampshire Citizen Health Initiative's goal is to develop a healthy population and high-quality, cost-effective, accessible health care for our state. And the Behavioral Health Integration Project incorporates behavioral health into primary health care driven by evidence-based models. And in collaboration with all of our partners, the Institute for Health Policy and Practice is working to improve health care in New Hampshire. And these projects that I just mentioned are just a small identification of some of the major things that we're doing. One of the celebrations that we've had is our collaboration with law school and the partnership that we have between the Institute of Health Policy and Practice and the law school. And it's certainly timely and provides additional focus on the health policy. And that collaboration is only going to continue to grow and strengthen between the two entities. UNH has had representation both from IHPP and the Institute on Disability and the Governor's Commission on Medicaid Managed Care. As the Senator mentioned a second ago, this is certainly a time of expected change in health policy, and UNH looks forward to working with the Department of Health and Human Services. We're looking forward to working with our community partners, our foundations, service agencies, academic departments, and other institutes, and make sure UNH assists in any way it can in informing policy discussions that will come in the future. This symposium that we have today is just one example of what we're trying to do within the state of New Hampshire. So I look forward to meeting with all of you during our breaks and various times throughout today, and thank you very much. And I'd like to introduce Margaret McCabe, Assistant Dean in the Law School.
Thank you, Dean Ferrara. Good morning, everyone. First of all, a warm welcome to UNH School of Law. I'm not sure, it's wonderful to see actually some of our alum in the audience as well as some of our adjuncts who teach for us. But most of all, it's wonderful to be able to host this event. As Dean Ferraro was just saying, we're really excited to be able to leverage resources within the university and collaborate with CHHS as a law school to provide an interdisciplinary forum in which really important issues about the future of healthcare in this state can be addressed. And I hope you all really appreciated what Senator Bradley just said about, you know, the uncertainty in Washington makes conversations and days like this so much more important today, so that at the local level, at the state level, we are creating solutions and we are knowledgeable about what is happening in healthcare. So we're really, again, pleased to partner with CHHS and IHPP. I'd also like to invite any of you who are thinking about law school or know people who are thinking about entering health law to really think about UNH Law as a place to do that. We're so proud of Lucy Hodder's work to establish an excellent health law and policy program here at the law school. And the thing that it does so well, and I know this from talking with Lucy's students, is to really take students' doctrinal knowledge that they're learning in class and couple it with a practical what's happening currently in the healthcare system and really prepare students to be part of the important decisions that are coming down the road in our healthcare system, not just here in New Hampshire, but around the country. So I hope you have an opportunity to really engage today, learn from one another, arm yourself with knowledge, and I just am really pleased that UNH Law can provide this kind of forum and be a convener. And with Lucy's help and Dean Ferrara, I'm sure there'll be many more sessions like this to come. So at this time, I'd like to welcome Yvonne Goldsberry, the President of the Endowment for Health. Thank you.
Good morning, everyone. It is an interesting time in health policy, isn't it? I joke with my staff at the endowment about cutting my teeth in health policy many years ago in Washington, D.C. on the Clinton health reform work. And to be standing here in New Hampshire and being in this position where we have the ability to convene a meeting like today is very, very exciting to me. So welcome. I add my welcomes to the previous welcomers to you this morning. And super excited about today because we get to go deep on Medicaid. And it's rare in our state that I think we pause for a minute to be able to explore the myriad of issues that we're going to explore today. So whether you're here as a provider or a policymaker or an advocate or just as a healthcare consumer, I know we have a lot of questions that we're asking. How flexible will our state end up responding to the changes? Will everyone still have coverage? Many of you have been working really, really hard on practice improvements and transforming our health delivery system. Will we still be able to do that? Will we be able to move at the same pace that we've been moving? So we have a host of questions that we're all asking. Today we're going to look at Medicaid in detail. We're going to look at who's covered. We're going to ask some of the questions that I just mentioned. We're going to talk about value. What is value? What does that mean in our state? And we're going to hear from our federal partner, so to speak. Cindy, thank you for coming, about what's the latest word at the federal level and its potential impacts on New Hampshire. So thank you for being here today to learn together, to explore all of these very challenging issues, and come with your great questions. We'll have lots of time for that today. And thank you as we look forward in sharing the conversations that we're going to need to have, as Senator Bradley mentioned, about what's next for us and how should we best respond. I look forward to the endowment having a role in future convenings and help in answering, sponsoring research to answer some of those questions so that we're ready when the final word comes at the federal level and that we're well positioned with a New Hampshire-based response. So enjoy the day today, and thank you for being here.
So we're now going to get on with the show, as they say. And briefly, I do want to acknowledge particularly the state regulators and state policymakers in the room. Representative Shurtleff and Cindy Rosenwall, and we have a number of representatives here, so if you want to wave, that would be great. And we have a number of elected officials. I see Andrew Valinsky. Thank you all for coming. What you do is so important to us every day. And I want to acknowledge the department. Deb Fournier is here. Jeff Myers would be here, but is off doing some work. We have a number of representatives from our Department of Health and Human Services. And part of today, I think we're going to hear from Washington how much we need to remember how hard they work and how many issues they have on their plate as we once again tackle new and important issues. So thank you from the department. We also have Rich McGreal here from CMS and a number of former CMS directors. So we thank you from the federal level for all of your input and connection to New Hampshire. That's instrumental. And our team has been so great. Could everyone from IHPP and Citizens Health Initiative just stand who are in here? And there are a number around. We have Kate Crary here is going to be doing some graphic design. She's a project director. Thank you, all of you. Thanks. Yes, and most of them are still in the other room. They were here late into the night packing and working and doing, and their content ability is just incredible, as well as their ability to manage all of us. Kate Crary is going to be, she is a project director at the Institute, and she is also engaged in graphic note-taking, and she will be, during certain of the panel discussions, taking graphic notes, which is an incredible tool that we have also together. So thank you.